All right, so this is chapter 16 for anatomy, and it's about the special senses. This video is going to talk about the anatomy of the eye, special sense vision. So the eye itself has accessory structures, things outside of the eye. These include 6 extrinsic eye muscles, so muscles that attach to the eye to move them. It includes your eyebrows, the eyelids, eyelashes, conjunctiva, which is a lining that produces a fluid around the eye, and lacrimal glands that produce tears. So the eyebrows, mine, are very easy to find. They're along the supraorbital ridge. So this is your orbit, right? So above there. And they add in nonverbal communication. You're surprised, your eyebrows go up. You're frowning, they go down. They also prevent sweat from dripping into eyes, so they do serve other purposes anatomically. Your eyelashes extend from the margin of your eyelids, and their purpose is protection, so they're preventing things from coming into the eye to harm it. Great pictures on this one. So your eyelids, that's the technical term for them, they're made of fibrous tissue, a little bit of muscle in there from the orbicularis oculi, muscle around it, and that sphincter muscle, and then thin skin. They have glands within them called tarsal glands that are sebaceous or oil glands that release an oily secretion at the eyelid edge, and this is an infection of that gland. You can see how painful that would be. Another little condition around the eyelid area, it's called a stye, where both sebaceous and sweat glands, because you have sweat glands in your eyes too, they get infected. It's called a stye. Oh, that was a good picture down here of a stye. I've had styes before. I've never had one of these. Styes, usually I will put a hot washcloth compression in that area a few times, and that helps to open up those glands to let them move the fluids out. The conjunctiva is a transparent lining of the eye itself in the lid surface. Have you ever seen somebody flip their eyelids up? That red lining is the conjunctiva. It has made of epithelial tissue, has many goblet cells which secrete mucus. And that mucus is to moisten the eye, and it has many blood vessels, that's why it appears red, and many nerve endings. It does not cover the cornea, however, so it covers the white part and then on the inner eyelids, so it doesn't interfere with light passage. An infection of the conjunctiva is called conjunctivitis, better known as pink eye is conjunctivitis, and it's very infectious, and you get drops to take care of it. When I was young, I had pink eye a lot. And this is just a review of the certain anatomical parts of the eye that you can take a look at in your spare time. This is a lateral view of the external eye, the muscles around it, the eyelashes, all that fun stuff. So another external part of the eye is the lacrimal apparatus, better known as producing tears. This tears is a fluid, of course, and the apparatus is everything together that produces, collects, and drains the fluid. The tears, they contain water, sodium. It tastes salty if you're crying and the tears run all the way down towards your mouth. It also contains antibodies, so it helps protect you, and by design it helps kill bacteria. Tears serve a valuable purpose to lubricate, cleanse, moisten the eyes, reduce friction when you're blinking, defend your body, nourish the cornea. The glands that produce the tears are called the lacrimal glands, and they're up in this area. And they produce it, and it flows towards the inside. You blink about 10 to 15 to 20 times per minute to wash the fluid over the eye. So the fluid is secreted over here, and it drains into the medial side of eye. And it drains into what's called a duct, a nasolacrimal duct, because that's the nasal bone, the lacrimal duct back there. And it mixes in the nasal cavity with mucus, and you swallow it, so that's fun. So that's the gland. It runs over the surface, wipes over the surface of the eye, and if you look very closely, I don't know if you can see it on here, if you pull your eyelid down, that's kind of gross, sorry, there's a little hole right there. That's where the tears, that fluid, empties into, and then it goes into your, joins with your nasal cavity. The eye itself, isn't that a cool picture, is almost spherical. It's about 2.5 centimeters in diameter, and it's located in the orbit, and it's anchored in a bunch of fat, called orbital fat. There are two cavities. The posterior cavity that contains a fluid is behind the lens, in that permanent vitreous humor, or called vitreous body. The anterior cavity is in front of the lens, and it contains aqueous humor, more water-like. And the wall, or the outside, has 3 layers, and we're going to talk about all of those layers. Here again, the 3 layers: external, which is the fibrous, and then the vascular tunic, and then the inner layer is the retina. Another picture of the eye. The 3 layers. This is the optic nerve, the lens, the cornea. So the outer layer of the eye, 2 parts. The sclera, this is known as the white of the eye, gives shape. It's an attachment site for the external eye muscles. The cornea is transparent part of the eye. It, at the front, if you have contact lens, you put it over your cornea. There are no blood vessels within the cornea, and its job is to, as the light comes into the eyes, is to help bend the light. It's called refract it towards the back of the eye. The next layer is the middle layer, called the vascular layer. It's very rich in blood vessels, and there's also muscles in this layer. It contains the choroid, the ciliary body, and the iris. The choroid has many capillaries that nourish the retina, many melanocytes, so it has a darker pigmentation. It absorbs light as it comes into your eye, which is very important. The ciliary body contains ciliary muscles and processes that extend from it. These muscles are connected to the lens, and they help change the shape of the lens as light comes through. And it actually makes the aqueous humor, that anterior fluid. The iris, also in that middle layer, is a muscle also, and it gives your eye its color. And it's the most anterior. You can see that my iris is green or hazel. Your iris contains smooth muscle that can cause your pupil to get smaller or to get larger. It also contains melanocytes that give your eye its specific color. And it divides the anterior segment and the posterior chamber. The pupil is the opening of the iris, and how the iris controls pupil diameter. You have 2 layers of muscles. I'm going to grab my sheet here, or my model. Okay. The middle muscles are the sphincter concentric circle fibers that when they constrict or when they contract, they make the pupil smaller. So that's your peripheral nervous system. Your parasympathetic nervous system. The other layer of muscles in the iris, out here, when they contract, it causes the pupil to get larger in the sympathetic nervous system. The reflex that causes your pupils to change is called the pupillary reflex. And this just shows that same thing. These muscles are contracting to make the pupil smaller, and the other muscles and the outside muscles are contracting to make the pupil larger. The retina is the innermost layer of the eye, and the retina is split into two layers itself. The pigmented layer provides vitamin A for your photoreceptors, the receptors that pick up on the light, detect it. So that pigment, any time in the eye where it's pigmented, it absorbs light, so the light doesn't bounce around in the eye. The neural layer receives light and converts it into nerve signals that your brain interprets. So the retina, the neural layer, so not the pigmented layer, but the neural layer contains 3 sublayers with different cells. The photoreceptors, this is where the rods and cones are located. We'll talk more about those. They react to the light. Bipolar cells receive the information from the rods and cones. Their dendrites are the parts that receive the input. Then the bipolar cells pass the information to the ganglion cells, and then they transmit it to the optic nerve. At the back of the retina, so if we take off, oh, there's a ping pong ball in there even. That's not supposed to have E. Take off the lens. We look at the back of the eye. The retina is rich in blood vessels. At the back, this is where the optic nerve connects to the retina, and that's called the optic disc. This is where our blind spot is because it contains no rods, no cones that can sense light. The macula lutea, which is just offset, can't really see it well in here, of the optic disc, is special, and it allows for discrimination of images. There's a highest proportion of cones in the eye or in the retina at that point. So your sharpest vision is located at that point, especially the center of that, called the fovea centralis. The peripheral retina, so everything, so if this is where images get focused most often for seeing things in light, colored things, the sides, the peripheral part of your retina, has a lot of cones. Cones allow you to detect images in a low amount of light, so if it's dark outside. And this is putting it all together, all the parts that I just mentioned in an image. You're going to want to pause on the image in your book and take a look and make sure you can locate these parts. This is where the vitreous body or the gel is, okay? Right there. Light goes all the way back. And then this arrow shows how the message of what was in the light is perceived by your nervous system. First, it goes into the rods and cones, then the bipolar cells, then to the ganglion. Those ganglions send the message to the optic nerve. Again, same idea there. So some problems with the eye. One thing that can happen is the retina can become detached. That's when the pigmented layer of the retina becomes separated from the neural layers, the cells with the neurons. This can result from getting hit really hard, head trauma. If you have diabetes, you can increase your chances for having a detached retina because it damages blood vessels. Essentially, you get no nutrients in that layer. Symptoms, floaters, curtain, you can't see as well, flashes of light. Macular degeneration, that's where that macula area becomes compromised. It's the leading cause of blindness in developed countries. High blood pressure can make you more higher risk for this. Previous eye trauma, diabetes. Essentially, that area that's supposed to be the best at discriminating what you're seeing becomes spotty. So you don't get as sharp as